Okay, I knock on my patient's door, they let me enter, I do my hand hygiene, I'll introduce myself. Good morning, my name is Claudia. I'm gonna be your student nurse today, and for this assessment we're going over the head, face, and neck. So first I'm gonna start off by asking a few questions. First question, have you been experiencing any unusual, frequent, or severe headaches?
No.
Have you experienced any frequent dizziness?
No.
Okay. So for the next portion, we're just going to inspect and palpate the head. Just by inspection, I'm looking first at the shape and size. I'm not noticing any abnormal enlargement or abnormal smallness of the head, so we call this normal cephalic. I'm also going to palpate the head, and I'm palpating just all over for any depressions, any protrusions. I'm looking for any lesions, lumps or bumps, but my patient's scalp is nice and smooth and intact. And from here, I'm gonna go over here and I'm going to palpate the temporomandibular joint. And I'm gonna have the patient open and close her mouth. And I'm checking for any clicks, any crepitition, any tenderness. Open and close, please. And any loss of range of motion, but everything seems to be moving normally. So then from there, I also want to make sure that my face is nice and symmetrical. We're going to look at eyebrows, the eyes, the nasolabial folds, which are around here, and then we're looking at the sides of the mouth, and my patient's features are nice and symmetrical. If we notice any abnormalities or asymmetry, if we notice that one side of my patient's face is drooping, that could be due to a patient having a stroke, or it could be due to the fact that there is damage to the cranial nerve number 7. So from there, I'm going to go over to the neck, and I'm just inspecting the glands right now. I'm starting off with the parotid glands, which are in the cheeks. Then I'm moving down, look up a little bit. Come closer. I'm looking at the salivary glands right here. I'm looking for any enlargements or swollen. And then I'm looking also at the base of the neck for any enlargement or swollen areas of the thyroid. So after that, I'm going to palpate my 10 sets of lymph nodes. I'm gonna start with the preauricular lymphs, which are right in front of the ears, and I'm pressing in gentle circular motions with the pads of my fingers. So from preauricular, we go to post-auricular, which is right behind. Then after that, we're going to occipital, which is back at the base of the head. Then from there, we're going to submental, which is right under the chin. Then submandibular. Then right on the corners, on the edge here, is the that's a long one. The jugulodigastric lymph node. Then from there, we're going to the superficial, the superficial, what's it called? I'm sorry, I'm having a blank. Cervical node, which is right over here. Then all along down side of the neck is the deep cervical chain. So again, we're palpating gently all down here. Then after the deep cervical chain, we go to the post-cervical, which is back here. Then after post-cervical, we're going to the supraclavicular nodes, and I'm gonna have you shrug your shoulders. And I'm just feeling in that little groove. And normally we shouldn't feel any tenderness, we shouldn't feel our lymph nodes, so that is a normal finding. So after we palpate and inspect our lymph nodes, I'm going to just check the neck's range of motion. So if you can just look up at the ceiling, chin up, chin down to the chest, then side to side like this, and then your ear to shoulder without raising your shoulder. Okay, and then last part, I'm going to be checking the function of the cranial nerve number 11. So by that, I'm just going to push down on your shoulders and you're going to resist it by pushing up. Okay, good. And now we're going to do the same thing but with your face. So I'm going to put my hand here and push against it. Turn your face. Okay, good. Now the other side, turn. Perfect. And that concludes my face, neck, and head assessment. Thank you.
Thank you.